Today, I'm going to walk you through how to become an NP in Canada, more specifically within Ontario. Let's walk and talk. First of all, you have to become a registered nurse, right? So that's a 4-year program. There's a lot of BSCN programs in Ontario and within Canada at large. After you go through the blood, sweat, and tears of being an RN, you have to get a job. And my advice is to get as many different jobs as you can to get that wide range of practice before going into an NP program. So for myself, I did a range of pediatrics, general surgery, internal medicine, psychiatry, forensics, family medicine, and then I got bored and wanted to become an NP. When I was doing my research about what NP programs were offered across Canada, there were many. I'd say the biggest ones are part of the Ontario Consortium. So there are 9 universities that provide the same primary healthcare NP material and education within Ontario. Most NP programs are in person, but there is Athabasca University that offers a 100% online virtual possibility of getting that NP degree. So in general, the primary healthcare NP role is biggest across Canada, but you can subspecialize and there are specialty programs offered at various universities. But today I'm going to focus on the primary healthcare programs. To get into these programs, most require at least a minimum of 2 full-time years of RN experience. But honestly, if you can get more, the better, because it is a steep learning curve when you enter that NP program. And a lot of these programs have, different specific requirements, but I would say you need good grades, you need good RN experience, and you need to write a good essay for a lot of these programs. And you definitely require some references. Could be academic and or clinical. Another question commonly asked is how long does it take to complete an NP program? Well, there are 2 streams. So either you complete a Master's of Nursing ahead of time or another associated Master's, which I did, and then you do a 1-year primary healthcare NP diploma program. Or the second option is you go into the MSCN NP combined master's program, which most of the universities offer, and you can get your NP within 2 years instead of 3, like I did. Another question is, what is the biggest leap from being an RN to an NP? Well, you have to know how to use diagnostic reasoning skills. You're actually diagnosing a patient, so that is by far the steepest learning curve and something that is very difficult to teach and learn. But there's a lot of information on my NP reasoning blog because I am extremely passionate about improving diagnostic reasoning, thinking mindset among NPs. There is in-depth information about the process of becoming an NP in Canada and within Ontario if you just visit my educational blog for NPs called NP Reasoning. It's all laid out, algorithms, visuals, might be a lot easier to follow. Check it out. That's all I got for now, folks. Bye-bye.